Good evening. Welcome to Jambo Radio. I am your host, Agatha Kabera. Welcome to Mind Matters. I'm super excited today. So guys, if you want to join in, please go on our Facebook, Jambo Radio Scotland. Make sure you download the app as well. And also you can join us on our website, www.jamboradio.co.uk. And also if you want to call in, you can call on 074 59 8222. So guys, today's topic is mental health in Africa. And I have a special guest with me today, Nathan. Nathan is a psychologist and he also has an organization in Uganda called Mental Health Focus Uganda. Guys, I'm going to let Nathan introduce himself. Hello, Nathan. Are you there? Hey.
Hello.
Welcome.
Thank you. My name is Nathan. To the viewers, I am a Ugandan by birth, and that is my nationality. Thank you, Aggie, for the first time engaging me on this. This is something new for me. I am so excited.
I'm super excited to have you.
Yes, I head a team of exciting psychologists from Uganda, and that is under an umbrella of Mental Health Focus Uganda.
Okay.
And we only focus on mental health related issues, trying to cap down until we have a free space in Uganda that really minds about the minds of other people.
Okay.
Basically that.
Oh, amazing. Can you tell us a little bit more about Mental Health Focus Uganda? Like, what you guys do, what you're doing in the community, what services are available, what you're trying to tackle?
Yes.
I mean, you've already said mental health, but, do you work with everybody, or do you work with just young people, older people, or just everybody?
So Mental Health Focus Uganda is non-government. It's an initiative that we started up as psychologists by the year 2016, and now we've been in service for all this time, trying to mitigate challenges people face. And I'm excited that, Agatha, you're aware about Mental Health Focus Uganda because you've engaged with the team at some point. Though you ran away from Uganda.
I'm back. Don't worry. I'm back now.
Yeah. So what we try to do is we really focus much on trying to see the gap, trying to fix the gap that has been in around Uganda, Africa itself, because we don't have data that someone can look at and say, okay, in Uganda, this is what so far mental health has done. This is where people have been challenged for a while. So we try to bring up the fact of research. And then the other thing is focusing on creating awareness about mental health related issues.
Yeah.
Very many people are out there, but they don't know exactly what they are suffering from. They don't know that there is reality behind suffering, and mental health is something key. So basically we create awareness in schools, out of school, communities. We go to the of course mental health wards, we partner with them, try to do activities that can let people aware that mental health is real, and everyone needs to really know that mental health can really be something achievable. At the end of the day, this is Africa. People think mental health is madness, and Agatha, I'm aware you're aware about this. People
definitely
think
that's the stigma.
As long as someone is not mentally well, they think they have something triggering them, maybe from culture, from their ancestral fathers and whoever. But something that So we try with our challenging country like Uganda. We try to look at that and see, at least maybe at some percentage, people will be aware that this is something that they need to know about.
Yeah. Okay. So I mean, I guess you kind of answered the question that I was going to ask was like, how's mental health viewed in Africa? So you've kind of answered it. It's like more witchcraft, cultural, like there's that stigma of people just thinking you're mad and not really.
Yeah, but basically that. People think in Africa, that is generally Africa. People think it's madness. It's not something to do with their, with their health. No.
Yeah. Yeah. So like with you working, in Uganda and you being a psychologist and stuff, like what are the most challenges that you've found when, trying to address mental health?
So one of the biggest challenge as a community mental health organization and as a psychologist myself is we are trying to fight to make sure that we have people achieve through their mental health, but there is a lot of what we call false information running through people's minds. So when we come out and we're like, okay, there's depression, and this is how we are going to say, in our local language, we'll be like, okay, there is a Nike, I mean, the Uganda know about this, and people are going to tell you, no, this is not true. This person is mad. I mean, their mother, their father back then was really, going through the same issue.
Yeah.
So there's nothing like mental health. What are you talking about? What is mental illness? So people are not aware. There's a lot of
education is needed.
Minds, and that is So there's nothing like psychoeducation.
Yeah.
And when it comes to other public hospitals, they are not talking about mental health. They are not only looking at physical health. How is someone feeling?
Yeah.
But again, they forget that there's the mind that can get sick. Yeah. So there's that failure to create awareness about mental health in Uganda, in Africa at large. That is the biggest challenge. Yeah. And the other challenge is, of course, resources. We don't have resources. Even our governments are not supporting. Yeah, I mean, you understand.
Honestly,
like 1% of
actually, it's not even 1%. It's less than 1%. Imagine, less than 1% of the health budget in Africa is given to mental health. Like, I found that so crazy.
And I'll give you an example.
Yeah.
I'll give you an example of Uganda itself. The less than 1% is taken over by a main hospital, which we call as a
Kabera
hospital.
Is that Kabera?
Butabika.
Sorry, Butabika. Why am I?
Yeah. And they will tell you that in Uganda we have less than 6 mental units, and that is probably the known ones: Butabika Hospital, Jinja, Masaka, and Kabera. Now you'll find that, for instance, an example of Masaka.
Yeah.
Covering almost a region, a greater Masaka region, covering like 6 or even 7 districts. So someone will travel for a whole day, come and access services from Masaka.
Wow.
And by the time they are there, they find no medication. Then they have to travel back to wait for death because there's nothing else you can do.
Crazy.
So basically, we don't have. That is something that really really gives mental health a big box. That you cannot open and flip out everything. Then the other issue is of course, like I talked about, awareness. I mean, when you look at when Uganda was hit by COVID, we were shocked as practitioners, as people who are trying to put out information.
Yes.
All mental health units, all mental health wards across all the regional referral hospitals were all covered by, COVID.
Oh, wow.
So, I mean, they turned the
really? They turned them into COVID wards? COVID. Oh, wow.
Yeah, exactly. So people could not come anymore to hospitals. I mean, remember, mental illnesses are diseases where a patient is supposed to take medication monthly.
Yes.
From the hospital. So they could no longer come to the hospital. They could no longer know where to pick medication from because the wards were no more. I mean, we came out and were like, okay, how can this really be, attacked? How can this be achieved? How can this be, handled? And when you talk, you hear people, complaining, we haven't received funds for our, facilitation as, as MPs, as, but people are suffering. I mean, so that is Africa. That is big.
I'm laughing right now because, like, I personally know, like, during COVID when it hit, like, obviously, as you know, I have a charity in Uganda, Baba Yangu, and we work with the street children. And I remember trying to help the kids, like, obviously they're on the street, so trying to get them off the streets and put them, like, in a home. And I called some MPs in Uganda to see if they could offer us a school or something. And honestly, the answer I got back for them was like, what do you know? You're not even from here. I was just like, what? Like, I'm trying to help you. Like what do you mean? Like, I was so shocked. And like how they do not care one bit, like, so what would you say, like, when it comes to mental health, like, what are the challenges that affects, like what are the challenges to mental health? Like, what brings on the mental health, would you say, in Africa?
So when you look at African countries which are hit by other diseases, other communicable diseases, let's say cholera, let's say HIV/AIDS, of course TB, tuberculosis, and when you look at Africa being hit by all these challenges, all these diseases, governments have prioritized these diseases.
Yes.
Forgetting that, I mean, mental illnesses also exist. And that's why we have the issue of less than 1% budget going to this sector. Because they think
the other diseases
HIV
are more...
HIV is mild. It is, something we need to focus on.
Yeah.
But remember, we have a correlation of all diseases between mental illnesses and these other diseases. True. Look at HIV, this psychosis. If you only want to, heal or attack or create awareness about HIV, you're not thinking about these patients.
Yeah. Even the mental health, 100% they're affected by them even just finding out they have HIV. Like, how can you not tackle that?
Exactly. Yeah. You forget that, and then that means you're doing nothing. That's why we have a very limited success when it comes to treating these other diseases, because we forget a factor of mental health in all we do to treat these people. I remember we had community outreach in one of the nearby places, Moswa slum area, and then we found out that patients would die because not because they are not taking medication, but the stigma behind what they are suffering from,
HIV,
takes them offline. So I mean, someone gets HIV, they are neglected by the family, they are neglected by the community, they are neglected by their friends.
Yeah.
At the end of the day, they engage themselves into they isolate from community. They do not get out. They become, dark in their own life.
Yeah.
And this takes them off because they are not going to eat. They are not going to be motivated to take medication.
Yeah.
At the end of the day, they die in there. So, I mean, this is what governments have not really taken in to think about, and people are dying that way. Then look at the challenge of, lack of medication. When you look at our mental health wards, the main medications they are giving, patients are, of course, you're going to look at a carbamazepine. You're going to look at the main one, and those are the main. And then, like, if it is not there, it's not going to have medication.
So is medication free?
You don't have medication for home.
Or you have to pay for it?
Yeah, it is. It should be, but because it is not there, patients are going to end up going to pharmacies to buy them, and they are extremely expensive. When you look at, medications and all these medical assistances given to our patients for mental illnesses are expensive. And remember, we have a main problem of poverty in Africa. I mean, people don't have money.
True.
And what do you expect? That's why we have very many people dying because of these, factors. And the other challenge, of course, as why we have, an increase in the rates of people who are getting sick mentally, is, of course, conflict and wars. Look at what just happened here in Uganda.
True.
Bomb blasts. People are scared. People are running into anxiety every now and then, and yet they have been through a big challenge of COVID. People are extremely anxious because of COVID. Then here comes in another problem of, unexpected blasts in the city.
And I can only imagine how people have been affected by COVID back home, because, a lot of people back home live by like paycheck by paycheck, it's so the economy has been down. Like, if it's been down here, I can only imagine how bad it's affected back home,
it's really, telling Agatha, it's really, really so hard back here, because one, we've had 2 phases of lockdown. You understand the African context of relationships in Africa. When it comes to marriage, there has been a lot of fighting, domestic violence. We've had students who are not in school and they are always home with the dads and the moms.
But the kids have been out of school for 2 years.
Exactly, 2 years. And this is the time everyone is going to exercise their power. Their power. Father is going to exercise their power as the head of home. Their mother is going to exercise their power as the mother of home. The elder brother or sister is going to exercise their power because they are older than these other little ones. So there has been this fight everywhere, fighting, So there has been a lot of, failure to exercise good decision making. We've had a lot of pregnancies because of idleness. There's no school, there's no work to do, everyone is home. So there's a lot of visits, friend visits. A girl goes, and by the time they come back, they are going to come back pregnant. It's really, really so hard that Africa has been hit that way. Apart from COVID coming in, it has brought in other challenges. When you look at the high rates of teenage pregnancies, when you look at the high rates of young mothers now in Africa because of COVID, it's too much. HIV is rising again, yet Africa had, put down the rates because there was a lot of awareness. But because of this idleness that COVID-19 brought in, these challenges have come back again. They are all on the rise because, awareness is limited. Resources have been diverted to, COVID, and forgetting that people on HIV medication need medication. So there's all of these challenges. People died. People who are suffering from, HIV died because there was no access to
medication,
hospitals due to COVID lockdown. All these things. Domestic violence. There has been a high rise in rape cases.
Wow.
All these happening because of the lockdown. And now That's why you see that all this links you back to mental health.
Yeah.
This links you back to mental health in the fact that someone who is going to be raped or who has been raped is going to get depressed, is going to really be traumatized, and that is mental health. That is mental illnesses. Someone who is home because they have lost their job because of COVID, there's going to be a lot of domestic violence because there's no work to do. As a father, you need to provide for the home. Yes. Everyone is looking at you. So we have suicidal tendencies, suicidal cases rising up because of failure to meet obligations. Yeah. So this is Africa. This is Africa with our mental health being again stuck on all the cases that we had handled before. Yeah. Things are getting stuck again, but we hope by such engagements we will find out what to do. Uganda can help Africa together come back to our level of trying, like we have always tried.
Wow. So guys, by the way, there's over 100 million people in Africa that suffer from clinical depression, and 60 million, that's 66 million, that includes women. That's just women alone. Depression is the most common mental health illness in the world, not even just Africa, in the world. I want to talk a little bit about alcohol and drug abuse when it comes to mental health, because when I was in Uganda and I was working with the street children, I felt like, that's one thing they definitely, went to as self-medication to deal with their mental health, is there any services even dedicated to that, to tackle alcohol and drug abuse in Africa?
I mean, all these, of course, when we're in school, they tell us, alcohol is bad, don't drink and drive, all these awareness, programs coming up. Yeah. But if you are going to tell me, don't drink and drive, you're going to tell me alcohol is bad, it should be for people above 18 years. However, you are allowing access
to kids to go and buy
how many people in Uganda, exactly, how many people in Uganda present their age when they're going to bars?
I used to get sent. I was 5 years old, and I remember I used to go buy alcohol for my siblings, bruh.
Exactly. Of recent, I had a discussion about drug abuse and children. But let's take an example of a local home where we have a father who's a drunkard, or we have a mother who's a drunkard. That is Africa. Local boozes, local drinks, local alcohol.
Yes.
Now, what happens? A father is going to send the son to go and buy for him. Yeah. When they get there, they are going to talk to a bar attendant. Dad has said, give me a bottle of beer or a bottle of liquor. And then this child has, mentally, the child has questions. What is sweet in this thing that dad always asks me for to bring? Yeah. And then the child, because we have the mentality of exploration. We want to explore as young people.
Yeah, you're very curious. Yeah.
People always want to explore what exactly is behind what they see, or what they smell, or what they touch. Yeah. So they are services are there, yes, to prevent alcohol use or drug use in Uganda or even in Africa, but these strategies being put up for implementation are weak, are very, very weak. Yeah. If you are trying, because it's a business, and when you look at Uganda itself, liquor, alcohol is the most selling. Why? Yeah. It is the most ably for everyone to be able to buy. It's cheap, very cheap. What is so hard for a Ugandan to get 3,000 shillings to buy a bottle of beer? Very cheap. So when you look at developed countries, I don't know how it is in the UK, but here in Uganda, it is easy to access these drugs, these these alcohol beverages, very easy. And then the other thing is, when you look at a country like Uganda, even other countries, the adverts, the message behind adverts on these beverages is so attractive to a young mind to explore, to want to explore about what is behind this energy. What is behind this, Agatha, I want to bring out this to your attention.
Okay.
You know why? Of recent, we had a minister challenging the government that Uganda has had a rise in teenage pregnancies and young motherhood because of energy drinks. And everyone was asking himself or herself, why, how? How do you attach energy drinks to what is happening? Me too,
I'm shocked.
and
explain.
Exactly. And everyone and the minister was explaining that these energy drinks have a content that stimulates or energizes sexual feeling. Young boys, and then what happens? They want to do what? To do what their body demands.
Yes.
Exactly. And we've had that argument several times, and we're like, scientists are saying, yes, this is true. This could be true. I mean, everyone is going to take these energy drinks and they are going to feel high, and then they want, that content which is in there. And you cannot argue that out. Because it could assumably be true.
Yes.
I mean, people have, when you look at Uganda, I think the so-called sodas and the waters are not being taken because it is all over, energy drinks everywhere.
Really?
So, like, we're going to get back to the alcohol part of it.
Yeah.
The adverts are so nice. They are so touching that everyone would want to test that beer, that crazy Coke. That I don't know how it would feel. Let me try it. And by the time we all know it all, we have the young people getting addicted. And that is where our mental health comes in. People are getting addicted to these drinks that they cannot let go. When by the time they realize they are really getting off track, it is too late for them to fight back. When you look at, we've had discussions in Parliament where they say we want to put a law governing these, companies that produce cigarettes, all that, because these are drugs. Exactly. These are drugs. And Agatha, you're aware, with your initiative in Uganda, you've worked with street children.
Yeah.
If you look at an example of Chisenyi here in Uganda, which is a slum area, many young boys, very young boys, from the ages of 6, using drugs, spirits,
drinking something alcohol, you start like from it's so normal.
6. Exactly. By the time and there's a factor behind age versus behavior. When a child starts to explore from the age of 6, that's when they start to differentiate good and bad. Start to differentiate what they are told and what their mind tells them. So by the time they are 6 and they are exploring these, they are finding their own brothers, their siblings using these drugs, they will take it to be the normal. And because there's no awareness programs in Africa, we are having these cases rising. I mean, poverty takes these street children to the streets. By the time they are there, the normal behavior is taking marijuana, is taking alcohol, taking spirits, sniffing spirits. That is the normal behavior down there. So, if this is still available in Africa, how do we expect to have a down drop of mental health cases rise. So that is something that is really eating up Africa. And this has always been our call to the to the well-to-do governments, the well-to-do countries. We need to have a chance to get resources that can really help create awareness programs in Africa. The other thing is we don't have resources, because without resources we don't have programs taken back to the community. You can only get awareness when you go to the hospital to get medication and talk to this doctor, to this psychiatrist about mental health. If it is not at the hospital, we don't have these services in the community. If it was by chance that these services can go up to our family or our home level in the community, we would have these chances, we would have these rises come down, because the awareness, the information has gotten where it is
should be.
We have a high rise in the death of people who are dying because of mental illnesses, because services can only be found at the hospital at a regional level. If by chance a psychiatrist or a clinical officer could go to the community and treat people from there, that would have a limited rise when it comes to the deaths of people who are dying. So I mean, this is Africa with limited resources of less than 1% government providing. Grants are not there to fund mental health services.
The funny thing is, I actually think the grants are there. They just don't reach the community. They don't reach the organizations that would actually do the work that's needed to be done, because I'm sure they definitely get the funding.
So the funding is there. But even when you look at, of course, we even have corruption. I mean, funding is going to
corruption is
and
the biggest.
by the time all the fund is done, because it didn't really meet its obligation, but it went through people's pockets. And look at the other issue of unsupportive ministries. For example, we have the Ministry of Health in Uganda. But I will come up with an initiative and with the heart to serve my people. But by the time I'm going to get approval, I'm going to be, questioned. Why do you want to do this? And at the end of the day, you're demotivating me as an advocate. Exactly. I'm going to lose the hope that someone can get better. Some of us are, of course, victims of mental illnesses. We know what it means for someone to be traumatized. I sleeping with my mother in a bush for over a month. I know what it means, because that is traumatizing. I know what it means for someone to be in the bush, to witness their mother being slaughtered off their head. I mean, that is traumatizing. I can understand. But a mother with a child on her back, with a spear, that is traumatizing. For me to see a young mother suffering with a child on the street, I mean, that is what people need to understand. We have governments that have not even thought about the realities behind mental health.
The trauma.
Imagine someone going numb because they got traumatized. We were in Yumbe, which is a district in Uganda that harbors most refugees, and you would find a kid of 6, 7 narrating how they saw their father chopping off their mother's head.
Wow.
Exactly. So that is something that is traumatizing. And when we talk about these issues, they're like, that is, wisecking around. You don't know what you're talking about. So it is high time for the community to realize these issues, for the community to embrace these issues, and policymakers should really embrace the fact, because we were here. And when COVID hit Uganda, many policymakers died. I mean, people in big offices, their lives,
were taken.
And that is when you would find an MP saying, it is true that my mind is not working well. I'm overthinking about You know how our policymakers are dying, our fellow MPs are dying. And that is when people realize that, okay, there is something to do with mental health. There is reality behind, people's thinking. And they could, come up and asking, okay, what is mental health? What do we do? But they could not think about, okay, saying this less than 1% budget. Why don't we increase it to 10%?
Yeah.
I mean, we need to have.
It's going to be good for them too.
Exactly. We need to have, psychologists attached to each hospital. And back then we had, I don't know if you heard of this, in Uganda, we had each school, we would have, was it called, not a caretaker, but a senior woman.
Okay.
But currently, you don't find a senior woman at each school. I don't know where that went. Why don't we have psychologists attached to each school? I mean, we have students who are committing suicide in schools because they are battling with thoughts and delusions in their heads.
Yeah.
They don't have whom to speak to.
Yeah.
They don't have whom
They're
to share with.
They're facing so much back home. Yeah.
Exactly.
Yeah.
We have a teacher, we have a parent, and we have a student. All these people have their own thoughts about what is happening.
Yeah.
A teacher is going to tell a student, you need to behave well. You need to be liked by other students. You're telling this daughter. When the daughter gets home, the mother is going to tell the daughter, a boy is not supposed to touch you. You're not supposed to be friends with a boy. Now, these are all two different thoughts running in a girl's, mind.
Yeah.
She's going to fail to negotiate what to take in and what not to take in.
Yeah.
So by the time she feels like I am old enough to decide for myself, she's going to be able to accept a simple gift of a pad, which she doesn't have.
Yeah.
Being given by a border guy.
Wow.
Which
oh my days, I really want to touch this subject as well, because there's so much. I feel like we've only touched we've only touched the top of an iceberg, because when it comes to issues and mental health issues back home, there is, oh my days, it's absolutely. And also one thing that I really wanted to even touch on, once I was doing my research about mental health in Africa, all I found was the mental health of women. Not once were men mentioned. And I'm just like, okay, do men not suffer? It's definitely, it's the same thing here, it's that way. We always forget about men and, the services that they need and, their mental health and stuff. And I could not even find one article speaking about men's mental health, which is absolutely shocking. But you know what, I think me and you are gonna have to do a part 2, because I feel like there's so much that I haven't even got to start getting into. We definitely have to do a part 2. Guys, you've had it, when it comes to mental health back home, first of all, there's no resources. There's less than 1% given, by government. And the funny thing, another thing, some of these policymakers or MPs, politicians, they know the issues, but them, what you say, they're just scared. They're legit scared to actually stand up, because I guess it's a fair point. You're scared for your life. They might kill you, but at the same time, I rather die for my people. I'm gonna come out of this world, at least let me come out for a good cause, than just sitting behind and just getting the money, and I think maybe it's with them as well. It's that mentality of they've been through so much poverty, so once they get their money, why are they gonna let it go? Our own president tells us, I am working for my own family. Everything I'm doing is for my family. So he's supposed to be the leader of these MPs and stuff. If your leader is like that, then myself, I'm only gonna worry about me, myself, and my family as well.
Yeah.
But like, one last thing, like, what got you to do psychology? I'm really shocked because when I was doing research, like, there's only like 0.05% of like psychiatrists in
Yeah.
Africa compared to how many there is here in Europe. You know, Europe has a higher number of psychiatrists, but you know, back home, like, I mean, what even gave you the motivation to be like, okay, I want to know about mental health? Was it like your own personal experience? Like, what actually got you to go and study psychology?
My it should be mentioned this way. It's my
Mm.
personal experience. I went
Okay.
through a lot when I was growing
Mm.
up, and really, I should say I didn't suffer alone. I suffered with my mother. And by
Okay.
the time I was crossing from high school to higher level
Mm.
institution for
Mm.
my further education,
Mm.
I realized there was something that can really be of help
Mm.
if I want to return back support to other people, to
Mm.
other mothers, So it was something that I felt like if I go psychology wise, I would
Mm.
be able to pass on the exact information that
Mm.
everyone needs to hear. This father who is fighting their mother every day, like as if they are grazing a goat or a cow,
Mm.
needs to understand the reality behind making this innocent woman suffer
Mm.
by themselves. Yeah.
Yeah.
So because of my experience with my father and mother,
Yeah.
I wanted to make sure there is a message that is going
Mm.
to go out there to make the culture of beating women,
Mm.
violence in
Mm.
homes
Mm.
come to an end. And that is
Okay.
my motivation. And that's why I had to venture into psychology and
Mm.
psychiatry. And
Yeah.
I have never regretted why I took that course
Yeah.
because it has helped me reach out to many souls that
Yeah.
have come out to testify that it is real.
Yeah.
Someone will get mentally ill because of bad treatment at home.
Yeah.
Let's look at school. Me,
Yeah.
my schooling was a tug of war where my
Yeah.
father is going to tell you what I'm going to why should I waste my penny paying
To
school
send
fees?
you.
Me, did I
Yeah.
go to school? That
Yeah.
mentality, things like that. So that is one thing that I embraced. And the challenge is that we don't have many people venturing into psychology and
Yeah.
psychiatry
Mm.
because they only think about
The clinicals. Yeah.
tangible things,
Okay.
money.
Okay. Money.
They
Yeah.
only think about how are they going to achieve success
Yeah.
through when you look at money. They think there is no work, there is no job.
Yeah.
If you're a psychologist, what are you going to do? Are you going to just speak voluntarily to
Yeah.
people?
Yeah.
But I'm telling you, me, I feel like it is worth enough for you to save a soul than earning 1 million shillings because you've, supported someone.
I agree.
I mean, my job is enough payment for me. My happiness is my money. As long
Hey.
as I feel
Hey.
happy to save a soul, I am happy. I am happy. And
Did
I'll
you
go
hear
to bed
that?
and I'll be like, wow, I'm so
Hey,
well
Nathan.
because I supported that soul.
Did
Yeah.
you hear that? Nathan just gave us God, bruh. Better believe, like, having purpose is better than money. It is definitely better, and I totally agree. And honestly, like, thank you so much for the work that you do, guys. Like, I will have Nathan back, and I think we need to start some kind of GoFundMe or something just to support the work that they're
Yeah.
doing back home, because they're doing amazing, and they're doing this. You guys fund yourselves. I've actually worked with Nathan and stuff. Like, they don't get no funding from government or anything. Like, everything they do is by their own resources, and like it takes someone absolutely amazing to just come out of their own way. And also, being back home, it's not like jobs or funds are readily accessible. So for you guys to do that, honestly, like, well done. But I'm going to have Nathan definitely back. Nathan, I hope you will come back for another like part 2. So so we can touch more on this discussion. But guys, our time is up. Nathan, thank you again. Guys, please, if you want to catch up on the show, make sure you go to www.jamboradio.co.uk. Also, it's always on our Facebook, Jambo Radio Scotland. And guys, I'm always saying, I want to interact with you. Like, let me know what topics do you want to discuss. Let me know if even the topics that we've already discussed, if you find them helpful. And it's always a pleasure to be with you guys. And I will catch you again next week, 5 p.m. Mind Matters. I'm your host, Agatha Kabera. Have a lovely weekend. Bye.